Hi friends, hello, welcome to my channel. My name is Joy. So currently I am a physician associate in general practice and here in the UK. So if this content is the type of stuff that you're interested in, then please stay tuned in. So today we're going to talk about high blood pressure. I thought, well, that's the best place to start, isn't it? High blood pressure, very prevalent, so very common in general practice and in the general population anyway. So what does high blood pressure mean? It means that we take your blood pressure, and there are two numbers that we look at. We look at the top number and the bottom number. So if we're saying that your blood pressure is high, it means that it's above 130 with regards to the top number, and it's above 90 with regards to the bottom number. So over 130, over 90 is high blood pressure. And within that, there's a staging process as well. So the higher up the numbers, so you start with stage 1, stage 2, stage 3, and you keep going. Okay, so up to stage 4. So and stage 4 would be an emergency, and you need to go not to your general practitioner but to A&E. Okay, so going forward, so we've talked about the numbers, and we need to talk about the risk factors. So I'm going to class the risk factors into two. Okay, so we've got the modifiable risk factors. So these are things that you can change. These are things that you can do something about if you wanted to help yourself to reduce your risk of high blood pressure. So the main one at the moment is I'm going to talk about salt intake. So we can definitely do something about that. If we're not aware already, most of the things that we use for cooking, most of the sauces that we use for cooking already have a high salt content in them anyway. The other thing that you can change is your diet and exercise. Okay, so you can be more cautious of what you're eating, and definitely being more cautious of the amount you're eating. That would be helpful. And I will add on to that as well, being cautious of when you're eating. Okay, so eating a midnight snack is not always a good idea if you are trying to reduce your blood pressure, but also in general, really, in your general health. Okay, so the next thing is alcohol and smoking. So these are vices that some people have. This is maybe something that some people don't have a problem with because they don't do anyway. But definitely reducing your alcohol intake with the hope that of actually cutting on alcohol will be good for your heart. The next thing is the smoking. Smoking, definitely looking for services to help you with stopping smoking. Again, you can approach your general practitioner and they will advise you on what services are available to stop smoking as well. And if you go on the NHS website, you can also get advice on stopping smoking. So definitely something that you need to look into if you want to help yourself with regards to reducing your blood pressure. The next thing is exercising. Again, you don't have to join the gym. I know sometimes finances might not allow us to do that, but we can certainly do some walking. We can always get a skipping rope and do some skipping. All those things add up to your health. So they will definitely help you with controlling your blood pressure. The next thing is your mental health. Stress, not great for your heart. Okay, so wherever humanly possible, please look into that and try and reduce your stress levels. I know it can be difficult to do that. There are different reasons why people would be stressed. People would be stressed with work, family, life. But again, this is just to help you kind of point you in the right direction with regards to things that you can potentially do to help yourself. And so let's move on to the non-modifiable risk factors for high blood pressure. Age. So naturally, as you get older, your blood pressure creeps up especially if you're not making any lifestyle changes as you get older. I think we've had this so many times where people are like, oh, when I was younger, I could control, I could control my weight better. This time around, it's a bit difficult as I get older. So unfortunately, yes, we need to put a bit more effort as we get older naturally. And by putting more effort, it means that we can keep our blood pressures in check. Ethnicity, again, being brown, being black, is a risk factor for high blood pressure, and that ties into the genetics as well, which are part of the risk factors, non-modifiable risk factors for blood pressure. And gender as well is another risk factor for high blood pressure. So being female or male. All right. So those are the risk factors we've talked about, non-modifiable and modifiable risk factors. Okay. So moving on to the next thing, we're going to talk about the symptoms of blood pressure, high blood pressure. So, and I think for most people, that's the most important thing, is knowing when you should suspect high blood pressure. The main thing that I've seen in general practice is a headache, a persistent headache which just recurs and doesn't go away. Definitely check your blood pressure. If that's the case, just rule that out. I know there are other causes of headache, but just rule blood pressure, high blood pressure out. Nosebleeds is another reason for, is another sign, possible sign of a high blood pressure. And shortness of breath is another sign for high blood pressure. And dizziness is another sign for high blood pressure. And the other thing is visual changes, blurry vision. It ties in with the headache. So definitely check your blood pressure, go and see your GP if you have any of these symptoms which are concerning. It might not be your high blood pressure, but if you're having shortness of breath, it could be other things as well going on. Okay, so complications of high blood pressure. If your blood pressure is not well controlled, there are risks to stroke, vision loss, heart failure, heart attack, kidney disease, and sexual dysfunction. Okay, so heart failure is something that happens over time if your blood pressure is not well controlled. Heart attack is what in medical terms we call a myocardial infarction. Vision loss again ties in with your vascular system. Okay, things that you can do: look at your diet intake, look at your sugar, your salt, exercise, reducing alcohol, reducing on smoking. All those things tie in to help you reduce your blood pressure. I do hope this has been helpful. If it has, then please stay with me, like, share, and subscribe. So I'll see you on the next video. Take care. Bye-bye.